Okay. All right. So our job for today, we've talked, I'm hoping everybody watched the lecture on on consciousness, because this is an extension of our discussion from consciousness. And whenever we're talking about any type of drug, whether it be a depressant, stimulant, or a hallucinogen, all of these drugs do have an effect on our consciousness level. And that's kind of why the drug, drug component is put into this consciousness section of the class. Okay. And so let's go through these, and then we'll have a little bit of conversation on how each one of them affects the nervous system and our levels of consciousness. So the first class of drugs that we're going to talk about are depressants, and these are drugs that reduce neural activity and slow body functions. This is a kind of an important note to make about depressants, because you might have seen people who have been taking opiates or benzodiazepines or barbiturates and alcohol, and they act very active. And this is the thing to keep in mind about depressants, is that they reduce the neural activity, which usually inhibits people's behavior. Okay. And when we see people who are on extreme alcohol or barbiturates and opiates, they have reduced inhibition due to that reduced neural activity. And therefore, they will engage in behaviors that they normally wouldn't if they weren't being influenced by that depressant. And that's why they're called depressant. And that's the important point, is it's reduced neural activity, which therefore, again, reduces normal inhibitions that you would have normal inhibitions before. So, and probably the best example of that is alcohol. So alcohol affects motor skills, judgment, and memory, and increases aggressiveness while reducing self-awareness. As we can see, this brain scan really emphasizes the difference between an intoxicated brain or without alcohol or alcoholism, okay? And the main areas to look for is this area right here and this area right here, okay? These areas, if we were to look at it, this is a slice down the middle. These areas are what connect the two sides of the brain, okay? Especially this area right here, the chasm here, and this area here. And this right here, that deals with that motor functioning that we're talking about when we were talking about the neural system. And you can see in these two scans, the reduced usage of these areas, especially over a lot of use over time, okay? Now, I want to talk a little bit about alcohol because of, increased aggressiveness and reduced self-awareness. And sometimes people will say, well, alcohol makes me a happier person, or people will say that it makes me have better judgment. I don't know how many times I've heard somebody who drinks a lot of alcohol say they drive better with a few drinks down them. And the truth is all of those effects that people say are positive, or we see positive about drinking, about people being more outgoing, people being more vivacious, is really due to what we call this reduced awareness, or another term for this is reduced inhibition, is that people are more willing to engage in activities that they normally wouldn't when they had a sober mind, because of the lack of self-awareness that the alcohol has. This area right here in the brain, and I think this would be the left side, I believe. This area right here and this area in here, these areas right here, all deal with self-awareness. And you can see within the intoxicated mind and scans of intoxicated people over and over, there's reduced activity and reduced mass in those areas. Okay. Now, this is what sometimes makes it so individuals seem like they're nicer when they're intoxicated, or they're more happy when they're intoxicated. But I want to talk just a moment about increased aggressiveness, because what we see is that people who are intoxicated will tend to be more physical in competition when they're intoxicated. And this leads to more aggressiveness. And again, it comes down to this notion of self-awareness and loss of inhibition. So the increased aggressiveness is because you have kind of an amped up system that has a reduced self-awareness that then increases this aggressiveness, okay? And then as we get more and more intoxicated, there's two other issues that come out of alcohol use. One is motor skills. The alcohol actually starts to, if you remember, we talked about the cerebellum, and the cerebellum has to do with coordinated movement, right? And the more and more alcohol that is affecting the cells in the cerebellum is why people stumble around. They're not able to walk in straight lines. It's because it's affecting the cerebellum, okay? And the other thing that we see with alcohol is issues of what are called blackouts, especially with excessive alcohol use. When it goes beyond a moderate level of use, we have two kind of things that happen. One, we lose memory of what we did the night before. And two, while we're in the action that we're in, we may have an impaired memory. In fact, there's actually in some states, they're actually stating that a person shouldn't be arrested while they're intoxicated because they won't have memory of having their Miranda rights read or the reason why they're being arrested for. And it's kind of a little far-fetched, but we'll see where that goes. But there are huge impairments on the memory system as well. When we look at use over time, intoxication can impair the brain functioning and the motor skills. Heavy use can increase risks of certain cancers, strokes, and liver disease. And I'll just read these real quick. Alcohol abuse, which can lead to alcoholism, is a pattern of drinking that results in harm to one's health, interpersonal relationships, and ability to work. Now, this is a brain scan of two 43-year-old individuals. One is a normal individual who may drink, but does it in moderation or drinks very little. And this one is a brain scan of a 43-year-old who is alcoholic. This is someone who drinks more than 4 to 5 drinks at a time, more than 4 to 5 days per week, okay? And as we can see, again, I'd focus on this lower end. So this is a kind of a cut through the face. If we remember, this area is the area of the brainstem and the limbic system, okay? And again, this area here, we can associate with connecting the two hemispheres, but also is associated with self-awareness and adaptability. Also, we can look right here and remember when we're looking at this area right here in the limbic system, and we can draw the lines here, draw the lines here. Remember that we have the hippocampus and the amygdala that play important roles in memory formation and memory retention. And as we can see in alcoholics, this is greatly inhibited from continued use and abuse of the drug, okay? And when we think about it, it also is what leads to the interpersonal relationship problems and ability to work. One, if you don't have memory, but also your emotional system and your relationship systems are also being underutilized or eliminated. That really affects a person's interpersonal relationships. And then we also see, because of this impairment, remember, activation of the amygdala has a lot to do with aggression. And when that activation is inhibited, that's where we get a lot of violence among alcoholics. This is where we can start seeing things like domestic violence, aggression at work, and those types of things. We also see that there's an association between heavy use and stroke and certain cancers, and definitely liver disease, because that's where it's metabolized at and starts to ruin those areas of the body system. Okay. Now, I do want to emphasize, when we talk about alcohol and alcohol use, we're talking about excessive use. Excessive use would be more than 5 shots at a sitting, and it usually ranges from excessive use 3 to 5 times per week. Okay. Other research that looks at moderate use, so we're talking about a shot 3 to 5 days a week, or a glass of wine with dinner, or a beer with dinner, has actually shown to have some other benefits. It's when the alcohol use becomes excessive that we start to get very concerned, and we start to see the damages due to alcohol. And so again, just like when we get to the thing on benzodiazepine, many of those are prescription drugs, and when taken appropriately, they can benefit the individual. But when they're taken in excess, they can start to do some real damage to not only our neural system, but that neural system then affects our life. Now, one of the question is if there's brain damage occurring, why is it that the brain creates these physical cravings? And we'll get to that here in just a minute, because one questions, if the brain is being damaged, why is it not rejecting the alcohol instead of creating those biological cravings? And we'll get to that in just a minute. Barbiturates are drugs that depress the activity of the central nervous system, reducing anxiety but impairing memory and judgment. Even slight overdoses can cause coma and death, and some examples of are neptutone, socolone, amytal are some examples. Okay, and if we think about barbiturates, they're one, considered one of the party drugs, but two, they're also considered one of the date rape drugs. So, and the reason is the reason they can be very addictive, and they can be very dangerous in a lot of ways, is that they're a very strong central nervous system depressant, and they're often prescribed to treat anxiety and as a sleep aid, because they relax the muscles, and they actually have been shown to also treat things like alcohol withdrawals. One of the most dangerous substances to withdraw from is actually alcohol. In fact, with heavy users, it's actually recommended that they go to the hospital as they go through detox, because seizures that can lead to death are a very common detox side effect of alcohol. And a lot of times in the hospitals, they'll use like Valium or Klonopin or Xanax in order to stave off those seizures that are very common with alcohol withdrawal. Okay, if you've ever known somebody who has been a long time alcohol abuser, anytime they're sober, they have tremors. They're constantly shaking. Well, that's an example of a seizure state. And if that's let go, you can see that as more and more of the alcohol leaves the person's system, it can lead to major more tremors and even result in seizure behavior leading to death. So if you know somebody who is a heavy alcoholic and they're wanting to stop, it's best recommended that they go and have them medically detox because of the dangers associated with alcohol withdrawal and alcohol detox. But back to these are, now I will say that these are highly addictive drugs. They should be highly controlled by whoever the prescriber is. I have worked with and I have known at least a dozen people who have been addicted to Xanax because they went to their doctor for an anxiety disorder. And then they were talked into by somebody or they wanted to, or they were having an extremely anxious day. So they overtook the medication and that suppressed the nervous system so much that it made them feel in a euphoric state. And so these drugs as taken as prescribed are good, but they really have to be very controlled by the individual because the overdose of them creates the negative effects and can lead to addiction to any four of these types of medications. When we talk about opiates, and most of you, if you've been anywhere near social media, news, or anything, knows that we're in an opiate crisis, an opiate overdose crisis. And so opiates are an opium that are derived, that are derivatives of morphine and heroin. And they depress neural activity, temporarily lessening pain and anxiety. The problem with opiums is that they're highly addictive. And I think there's a slide on it. I think, okay, yeah. So they're highly addictive because they increase levels of serotonin and dopamine. And we'll see here, and if we look at this next slide, these areas in the brain deal with the reward and pain systems, especially here. And then when we get into the peripheral lobe up here, but especially this area deals with reward, where we in the limbic system, if you remember when we were talking about that. And there is a heavy number of both dopamine and serotonin receptors in this area that the drug sticks to. Okay, and in between the neural gaps of each of the cell, and so it acts as a super reward system for the brain system, while at the same time alleviating pain. Okay, believe it or not, it's kind of interesting. When we later in the semester we'll talk about relationships. And there's biological underpinnings to intimate relationships. When you first meet somebody, your brain will start releasing a natural amphetamine, which is a stimulant, which we'll get to here in just a minute. And that's what keeps us obsessed about another person. That's what keeps them the center of our attention. That's what makes most of the time feel very euphoric about being with that person. But then at other times we feel very paranoid and nervous and scared about being the person. Those are all side effects of amphetamine, okay, which our brain naturally releases when we get into an intimate relationship. And then somewhere about 4 or 5 years down the road, the brain switches from making amphetamine when you're around your intimate partner to making a natural opiate, which then calms you down and makes your relationship more companion. This is where you feel more relief and stability in your relationships. This is when you start feeling that more calmer and more content in your relationships. because the brain switches from making a natural amphetamine to making a natural opiate. And this is what in the literature we call the companion phase of relationships, where it becomes less intense, less thrilling, and becomes more calmer and more stable, if you want to put it that way. And this is also when we see the pain reduction benefits of relationships, where just being near an intimate partner can reduce pain, again, because it's shooting an opiate-like substance through the brain and help calm you down, okay? GHB, which is, again, I've talked about this, is the date rape drug. The things that are associated with it is relaxation, elation, loss of inhibition. And the big one is suggestibility and increased sex drive, okay? Now, I want to make this clear. This increased sex drive is on the biological level, okay? Meaning that it increases the biological arousal system, which if you think about it, for again, some rapists, it justifies the rape, because while they were aroused, the female was lubricating, the male was erect, all of those types of things. But also on the other side of it, it also makes the rape quote unquote easier, because the physiological systems are working. And then there's the idea that there's an increased suggestibility with GHB, meaning that you're more likely to agree to something that you normally would not engage in, such as getting in a car with a stranger or going to a secluded place with a stranger. Now, that doesn't justify the rape, but it makes it so that the rapist has an easier time luring their victim to where they want to be. And just like with alcohol, we get the loss of inhibition, meaning more likely to engage in behaviors you wouldn't normally would. And the relaxation and elation, which again, for the rapist, suggests that the individual wanted it, one. And two, it makes the experience for the person who is being raped less traumatic when it is happening. And then the trauma happens after the drug leaves the system, okay? All right, so those are examples of depressant drugs. Does anybody have any questions about the depressant category of drugs?
I have a question.
Yes.
What was the drug discussed after alcohol?
It was, let's go back. It was, let's see, no, that wasn't opiates. It was benzodiazepine. And it includes Valium, Clozapine, Xanax, and Ativan.
What was the second one, number 2 then?
Oh, it was number 2, barbiturates. I'm sorry, I skipped that one. So these are barbiturates, which are reduce anxiety and impair memory and judgment, and a lot of these are again used also as what is the name of the? They're the opposite of ecstasy, but they kind of have the same effect. So. But these are very dangerous because of overdose. Slight overdose can cause coma and death.
Okay, thank you.
Hmm?
Can you go back to the benzos? That I think I got that. I think I got that confused with barbiturates. Okay.
Okay, got it. Okay, any other questions about the depressant section? Okay. And just kind of remember, when we're talking about depressants, it's about a suppression of the nervous system. It's not about the clinical term depression. Okay, and so a lot of people get those mixed up for some reason, is they feel like these drugs create depression moods, when that's not the case. They depress the nervous system, which then results in less inhibition and motor control problems. Okay. All right, so stimulants. So unlike depressants, stimulants excite the neural system and speed up body functioning. And probably the two most popular legal ones definitely are caffeine and nicotine. You can pretty much buy these at most stores, in most locations. And then we have cocaine, amphetamine, and methamphetamine. And then, of course, the popular drug of ecstasy, which is used in a lot of parties. So, but let's go through each of these. So these are, again, what these are about are stimulating the nervous system. And so when we talk about psychoactive drugs like these, we have three that we're really focusing on when we're dealing with stimulants. One is norepinephrine, which is associated with alertness, concentration, and energy. That's the positive effect of these stimulants. Serotonin, which is obsessive and compulsive type of memory. Again, I know this sounds weird, but those are considered positive things about stimulant drugs. For example, with methamphetamine, this is where you'll hear stories about a man mowing his lawn at 2 a.m. in the morning, or a person cleaning their house from floor to wall to ceiling. It's because it's affecting that serotonin system. And then dopamine, which is pleasure, reward, and motivation. People who report taking cocaine talk about going for at least a few minutes, 10, 15 minutes, into what's called Superman mode, where they feel like they can conquer the world and the world is conquerable. Okay. But then when we see when stimulants are like this start to really amp up these systems, we also see the negative effects. So for example, when we see dopamine and norepinephrine, okay, we start to see attention deficits. Okay. When we have too much dopamine and serotonin, we see appetite, sex, and aggression issues. This is why a lot of people on methamphetamine, which affects both of these two systems, lose an incredible amount of weight very quickly. When we mix norepinephrine and serotonin at a too high of a rate, we get anxiety, impulsivity, and irritability. A lot of time, paranoia. This results in the paranoia we see with a lot of stimulant drugs. Okay. And then when we mix all four, we see effects in mood, cognition, and cognition functioning, meaning especially when they're coming off of these drugs, they're going to have a rebound effect. And this is when nobody really likes being around these kind of people, because they're irritable, they're angry, they're frustrated, they're moody. And so when we see these three together, and then we see the fall off from the drug, we really see the interaction of these three neurotransmitters. Okay. Caffeine and nicotine specifically can increase heart rate and breathing rates and other autonomic functions to provide energy. Okay. And again, when we look at specifically, for example, caffeine, when taken, it's a lot like alcohol. When it's consumed in moderation, meaning 1 to 2 cups a day of coffee, for example, that it can have benefits on a person's health. In fact, there was just an article released in the Psychological Sciences that indicated that moderate use of caffeine is associated with longevity, as an example. But again, like with everything, when we start to overuse, this is where we start to see damage. Specifically with caffeine, when we see people who chronically drink energy drinks and coffee and caffeinated soda over time, this is what puts people at something called at risk of something called cardiomyopathy. This is where the walls of the heart that is all muscle start to harden and widen, and it makes it so that the left chamber is not pumping the proper amount of blood out of the heart. So a normal heart, when it fills up in the left ventricle, should fill up to about 70%. And then that 70% is then pumped out of the left chamber of the heart. People who have had chronic use of caffeine and overuse of caffeine with energy drinks and all that, they can see a what we call the chamber of the heart only fill to about 10 to 14%. And a lot of these people are then put at risk for heart failure. In fact, if this happens and the heart is reduced to that 10 to 14%, the probability of that person living for another 5 years is reduced by 65%. So it can lead to heart failure and all of the other negative effects, plus low energy, the inability to go outside and walk around in temperatures above 85 degrees, because that overworks what little the heart is pumping out into the system, and it can cause a whole lot of issues. So the thing that we get really concerned with, again, with caffeine, is its effect on that autonomic system, specifically with the heart. With nicotine, we get really concerned because of the autonomic functions dealing specifically with the lungs and the lung system, but also nicotine's effect, again, has effect again on the heart and in some neural areas of the brain. So that's when we get concerned, again, due to overuse. So what is healthy for caffeine use? So when we say it starts to affect really your health is when you're ingesting 500 to 600 milligrams a day, and it can cause all of these different types of issues. And again, I'll emphasize chronic use with abnormal heart rhythm actually can lead to cardiomyopathy. But above this level, especially with continued use, you get restlessness, anxiety, irritability, muscles and tremors, sleepiness, headaches, nausea, diarrhea, and gastrointestinal problems. Okay. Now, I will say that I've worked with a lot of people who say they can't live without constant intake of caffeine. And that's when, if you have someone in that situation, I'd highly recommend that they go get a sleep study, because they're probably suffering from a sleep disorder such as narcolepsy or sleep apnea. And a lot of times people who say they just can't function without coffee tend to, without caffeine and excessive amounts of caffeine during the day, they're usually suffering from some type of sleep disorder such as narcolepsy or apnea. And this is just an example of how much caffeine is in different things. So we can see drip coffee is at one of the most at 164. When we look at different sleep aids, we have no-dose, which is at about 200, and Vibrant, which is at about 200. And so I wish they would have put energy drinks on here because it's kind of an interesting, I think that actually is next. And then when we look at different energy drinks, for example, NOS has 216 milligrams of caffeine, and energy drink known as cocaine has 280. And if you remember, when we're comparing this to coffee, which was between 135 to about 164, a lot of these are double the amount of a cup of coffee. And as we can see, if we drink more than 2 of these a day, it can lead to that overdosage of caffeine for the individual. Okay. The other one that I want to focus on for our class is amphetamine and methamphetamine, which are stimulants in neural activity causing elation in the body function associated with energy and mood change, with very devastating effect. If we look at this picture of this young lady here, this was pre-methamphetamine, and this was over about a 12-month period of use. And it just took very quickly an aging process. The reason behind that is, if you remember, the area of the brain that is associated with aging and everything is the limbic in the thalamus area. And that thalamus area is very reactive to dopamine receptors. And methamphetamine really reacts to dopamine levels. And I'll give you an example. The highest level that a human being can produce dopamines naturally in the body is when a human being is having a sexual orgasm. That is when we can naturally create the highest levels of dopamine naturally, okay? When we look at methamphetamine, methamphetamine is double that. So let's say with an orgasm, you produce 100 units of dopamine. A shot of methamphetamine would be 200 doses of dopamine in the brain. And so if you can think about that, how incredibly stimulating that is to the neural system, and how quickly a person becomes addicted to it. If you think about, in a normal sexual situation when there wasn't trauma, most people don't go, well, I'm never going to have sex again. Okay. Again, in a healthy sexual situation, there's definitely outliers dealing with trauma and those types of things. Well, then you think about doubling that amount of stimulation you got from that act. And that's why methamphetamine is so addictive. Okay. And so just to keep those kind of things in mind. And again, we do release natural amphetamines when we first meet someone that we're really attracted to. And there are actually people who are addicted to falling in love. And they fall in love, they get that amphetamine dose, and then in the relationship, when it gets to the commitment level and the amphetamine levels start to go down, the person cuts the relationship off and instantly gets into another relationship. And we've noticed that with individuals who are like this, that it has a lot to do that they have very sensitive dopamine receptors in their brain system. And so that dosage of amphetamine from falling in love is what they're actually addicted to. And that becomes an addictive cycle for some people. Cocaine induces what's called an immediate euphoria, okay? Followed by a sudden crash. And some forms of cocaine are crack, which are a form of cocaine that can be smoked, and other forms can be sniffed or injected. Okay, cocaine comes from the coca plant. The same place you get your chocolate on your Snickers bar is what can produce cocaine. And in fact, don't try this. You'll get incredibly sick. If you eat 2 pounds of dark chocolate, you'll get what's called a hit of a cocaine euphoria high. That's a sufficient enough of cocoa in order to create the same stimulation of cocaine. And also cocoa is where we get a lot of our caffeine induced issues from, or caffeine comes from. So cocaine, again, it has an immediate high of euphoria, what we call the Superman effect, where the person feels like they can conquer the world, but it only lasts about 30 to 45 minutes, and then there's a severe crash. Because what happens is that the cocaine is washed out of the neural cleft, and the cells are going through a rebound effect. And so you become very lethargic, very grumpy, very tired. And the brain instantly starts to crave more of the cocaine. Okay. And then when we think about crack and smoking and injection, that is just a ramped up or a super high concentration of the cocaine metabolism. Okay. And again, like we can go back to other drugs, again, cocaine targets the dopamine centers of the brain specifically. So when we look at these two areas of the brain, are where we have the most dopamine receptors. And when we look at where cocaine hits, we see high concentrations here, high concentrations here, and concentrations here. And that's really is what creates the high stimulation of the cocaine. And as we can see, the cocaine as a receptor, it binds to these areas here, which then increases, again, when we look here, it mimics the natural dopamine. And so then it binds to the next cell, which then increases that neural activity. Okay. And then one of the other stimulant drugs is ecstasy, or I'm not even going to try and pronounce that. I'm just going to say MDMA. It is a stimulant and a mild hallucinogen. So we'll be talking about hallucinogens here in just a minute. This is where we get a combination of both a stimulant drug and a hallucinogen. And what it does is it produces a euphoric high. And what it really works on is it does have some effect on the dopamine system, but it really affects the serotonin producing neurons. Okay, if you think about serotonin again and what it's associated with positive emotions. It's associated with memory and emotional memories. And so the big issue with MDMA is that it can create deflation of mood and impairment of memory. And that's what we get concerned with MDMA, is that it can really create someone who does not have clinical depression. It can create clinical depression, and it's permanent, because in the brain, once these serotonin cells are dead, they're dead, and there's no recovering from them. So a lot of people who have severe damage from overuse of MDMA often tend to have to use more extreme treatments for their mood disorders, such as installation of electrical probes into the brain, which then stimulate other areas of the brain that disrupt depressive moods. And we see also severe impairment in memory. A lot of young people who have dementia, we often find that they used a high level of MDMA in their teen to early 20 years. And so that it is very much associated with early onset dementia. There's been people who have used MDMA in their teens and 20s and are experiencing severe retroactive dementia or memory loss by the age of 25 to 30. And again, when we look at the reasons why, remember serotonin, we have the amygdala system here, and then we have the hippocampus and the hypothalamus, which are all associated with long-term memories right here. And then as we go down, we can see the effects on the brain stem. And again, when we get into the other systems, because remember the hypothalamus and everything affects the pituitary gland. And therefore this causes hormonal changes, which can result in things like renal failure and arrhythmia. And again, when we see overdoses of things like MDMA, it's usually due to the renal failure that the person passes away from. It's not actually due to the damage that is being done to the brain. It's usually the renal damage, damage to the liver, damage to that system. And so this is what we find when we find it. So we have a normal system acting here, and you can see that the encapsulation, we have ecstasy, which creates the elevated mood. But then afterwards, and this is what creates the depression-like symptoms and irritability, we can see a lot less release of natural serotonin and a lot less uptake into the next cell. And that's what we start to get concerned with. Now, I will state again, just like every drug, there are some benefits to MDMA. When a person has an overactive serotonin system, sometimes a doctor will prescribe MDMA to purposely reduce this serotonin activity. There's a common disorder that can be caused by antidepressants, which increase serotonin in the system, called serotonin. It's how I can't remember. It's basically a serotonin intoxication disorder, which can create extreme headaches, extreme irritability, extreme agitation. And sometimes, if it's bad enough, the person will go to the ER. And they will give an MDMA in order to reduce those serotonin levels. And again, when we look at the effects of MDMA on the cerebral cortex, we can see this is a control level. This is people who haven't used ecstasy. And then we can see that immediate reduction of serotonin levels 2 weeks after, and even 7 years after, we're not back to control levels with serotonin. And again, this is why we get concerned with the use of MDMA, especially excessive uses. All right. Any questions on stimulant drugs? All right, let's go on to our last category of drugs, which is hallucinogens, or what we call psychedelic or mind manifest drugs that distort perception and invoke sensory images in the absence of sensory input, okay? When we think about hallucinogens, probably the two most popular are LSD, which is a powerful hallucinogen drug that is also known in the street as acid. And it comes from a kind of a fungus type of derivative. And then we have THC, is the major active ingredient in marijuana, which triggers a variety of effects, including mild hallucinations, okay? So here we're talking marijuana, and here we're talking LSD, okay, or acid as suggested, okay. What does marijuana do? It overactivates what's called the endocannabinoid system, causing high and other effects that the user experiences. These effects alter perception and mood, impair coordination, difficulty thinking and problem solving, and disruptions in learning and memory. Okay, I want to see really quick. Okay, so you probably have all heard, especially being here in the state of Arizona, the arguments about medical use of marijuana, the medical benefits, and then again going on with that, the recreational use of marijuana. And so when we look at the benefits of marijuana use, we tend to see that it has a good effect for people who have anxiety and pain problems or chronic pain issues. And we see that it can have a positive effect on individuals who suffer from things like anxiety and from pain. The times that we get concerned about marijuana use is when it's taken in very high dosages. Because it can affect a lot of the systems dealing with thinking and problem solving. A lot of people talk about marijuana fog or head fog when they're coming off the THC levels that really deal with thinking and problem solving and also learning and memory. With that being said, when taken appropriately and at appropriate levels, it has been shown to help with things like mood and pain issues, okay? And we also need to understand that there's an individual response to it. Again, when we look at the effects, and we see that it's considered a hallucinogen and can create mild hallucination. One possible side effect of THC is paranoia. A lot of people who are very sensitive in this area of the brain that deals with the endocannabinoid system, if they have very highly sensitive receptors, they can become very highly paranoid while on THC. And this is where people say the person had a bad trip or something like that. And so again, with marijuana, we have to be aware of overuse or over dosage of THC. And we have to look at its benefits when it comes to individuals, as it says in a lot of ways, marijuana can have the same positive effects we see with alcohol, but none of the dangerous effects of alcohol. And that's why advocates for marijuana kind of say, well, listen, it can have the same influence without the same negative effects. So that's some of the arguments for the use. There was one other thing, and then again, the hallucinogen effect is what can affect a lot of the paranoia we see with THC, but it's also one of the reasons there's people who have creative moments using THC. So as people who are sensitive to these areas or these systems either can become very highly paranoid and think that people are chasing them or something like that, or they can become highly creative. And there are people who claim that they're only creative when they're high. I want to go back because I don't think we have another slide on it, and I didn't know we didn't. Okay, yeah, we'll get over this in just a minute. Ecstasy, marijuana. I want to talk a little bit about LSD because if anyone is keeping up with the literature, especially in clinical psychology, there is a lot of arguments for the use of hallucinogens in the treatment process. So again, here we have a situation where we have a drug that can be highly dangerous, but then again, highly beneficial at the same time if taken in the right dosage. And if anybody is going into clinical psychology, I would encourage you to kind of look at some of the new literature that is coming out on the use of hallucinogens in the treatment setting, because we are seeing that when done at the right dosage, it can have some high benefits for people who have post-traumatic stress disorder, depression disorder, anxiety disorder, and there's one other disorder that I can't think of right at the moment, but we're finding that in combination with other treatments, and during the treatment process, such as during psychotherapy, LSD is starting to have some benefits for at least a portion of the population. So if you are interested in the clinical counseling field, I would encourage you to look up the current literature on the use of this drug. Okay. So again, just to kind of summarize what we've gone through, and we're not going to do these today. Alexis, yes, they are doing research on microdosing with LSD in very controlled situation. Interestingly, it is our US military that is taking the forefront on that research and using it with military individuals who have PTSD, for example. So yes, microdosing is becoming a big area of research right now. So we've talked about stimulant, depressant, and hallucinogens. What I want to talk about for just a moment is the signs, types and signs of addiction. Okay, so again, if we look here, this is just a summary of the things that we've talked about. And of course, alcohol, the negative effects are here, adverse effects, pleasurable effects are listed here. So again, when we look at drug use, we have to remember that there is a pleasurable aspect to them, that people don't take them because they're going to experience all of these negative effects, that the purpose behind drug use is its pleasurable or beneficial effects. Okay. And so when we look at the influences of drug use, okay, okay, no, we're not going to get into that. When we look at influences and the potential for addiction into a drug use, we have to take in the biopsychosocial model because it's just not people are genetically predisposed to addiction. Okay, a person who has no addiction in their family history can become an addict. And there's been a big, unfortunately, I feel, a big myth that has been developed in the addiction culture and the addiction recovery culture, that it's only people who are biologically predisposed genetically that can result in addiction. That is a myth. What biology does do is increases the probability that an individual can become addicted to a substance, but it's not the only determinant, okay? And again, when we talk about biology, we need to look at the effect that it has specifically on the dopamine reward system, because that is where the addictive and the obsessive cycle within the brain really occurs, okay? Beyond biology, we have to look at psychological influences, okay? Such as lack and sense of purpose, significant stress in one's life, and psychological orders such as depression can also lead to overuse of substance and drug addiction. And we can also need to take in effect social cultural aspects, such as being in an urban environment. People in an urban environment tend to use more drugs. Belonging to a drug using culture or group where drug use is acceptable and people are exposed to it. And then if we go back to classical and operant conditioning, which we'll talk about in a week or so, people become conditioned to that environment and to those individuals. And peer influence has another big impact. And to kind of conclude for today, this psychological is the area that we treat when we put somebody through relapse prevention, when we put someone through a treatment program. Detox is when we're working on the biological level. But for some reason, we have the tendency as a treatment community to stop here. We stop at the psychological and the biological level, and we don't take into considerations the social cultural factors that influence drug use. And psychologists like me and others believe that that's why relapse is so high, and relapse into drug use is so high, because our treatment modalities only focus on these two areas. And I'll give you an example of this. In my past life, I worked as a clinician in a women's prison, and a lot of the women came in with addiction issues and drug and substance issues. And we kind of had a naturalistic experiment. One of the things that this prison did really, really good is they had really good physicians that would help detox from a drug. And then also, if there's biological deficits, provide other drug treatments that would help with the addiction. And they also had a really, really good relapse prevention program and psychology program that really focused individuals on learning the skills not to become addicted, addressing the issues of things like depression and stress and sense of purpose. They had excellent programs in these areas. So when they were being released from the prison system, we knew they had the skills, and we knew that biologically they were stable when they left the prison system. Okay, so this is a situation we have. All right. Now, one way to measure success in prison systems is what's called recidivism rate. Okay. And here in the United States, the average recidivism rate for a first-time offender, meaning the probability that they will return to the prison system, is 60 to 70%. So a first-time offender going into prison, when they leave, they have on average a 60 to 70% chance of reoffending and ending back up in the prison system. Okay. Well, we kind of had a naturalistic experiment where I was working at, because we had people who were released to their community that they came from. This. Okay. And then we had offenders who were not released to the community they came from. They did what were called, for example, interstate compacts, where they went to a totally different state, or they requested a judge that they be released to another side of the state instead of the community that they came from. So here we had individuals who were released back into the environment that they came from, and people who were released not in the environment, in a different environment than what they came from. Okay. And then we measured recidivism rate. And for the people who were released back into the community, the recidivism rate was 66%. Okay. For people who were released to a different place, the recidivism rate was less than 10%. Okay. And this is what I mean when I say we have to take into consideration not only a person's psychological addiction and why they use, their biological dependency, but the social cultural variables matter as well, as can be seen by recidivism rates in the studies that I did when I worked for a women's prison system. So there we have it, the model that we should look at when we're working with or trying to reduce substances in our own life, or we know someone who has addiction issues within our family or within our community. This is really the model we should try and aim for, is what we call this biopsychosocial model. Okay, so let me end here. Does anybody have any questions about substance use, the effect of substances on the nervous system from today's lecture? Okay. All right, we have 2 orders of business that we need to take care of.